this Ministerial Conference on Ending Violence Against Children.
Over the next 2 days, ministers, delegates the conference in Bogota and subsequent week on ending violence against His Excellency Ambassador.
Distinguished at the first global ministerial conference of our first pledges, we have made colleagues from the Minister of Education for your hard working and Minister of
Children comprises nearly 1/3 of South Asia's population, a vibrant generation of over 600 million young minds. They are the custodian of our future, the bedrock of our socio-economic potential, and the ultimate measures of our civilization's progress. Yet, as we sit here today, a sobering and uncomfortable truth confronts us. For millions of children across our borders, childhood is marred by fear, exploitation, and silence.
I speak on behalf of UNICEF across South Asia, a region home to nearly a quarter of the world's children, where violence remains a daily reality for too many of those children. More than half of the world's children who experienced severe violence last year were in this region, not elsewhere but here, in our homes, our schools, our communities, and increasingly online. Violence in childhood is not simply harm in the moment, it shapes that child's entire life. Children who experience violence are at greater risk of mental health conditions, of chronic disease, of being drawn into substance abuse and criminal activity later. The costs fall not only to children and families, but on health systems, on economies, and on the social fabric of society.
As you know, violence does not happen in just one place. It follows children everywhere. But there's something even more worrying. Most children do not speak up. Children said they stay silent because they are afraid of being blamed, judged, or not believed. Many don't even know where to go for help. And even when they do, they don't trust the system. As one child said, most children don't know whom to trust and don't know who to reach out to. Violence does not just hurt in the moment. It changes how we think, feel, and live. Children described feeling anxious, scared, and alone, losing confidence and self-worth, and struggling in school or dropping out.
Every child has the right to grow up free from fear, abuse, and exploitation. Yet, across South Asia, millions of children face violence in their homes, schools, communities, and online spaces. We know that this violates their fundamental rights that we are bound by law and conscience to uphold. But many do not know that it also leaves deep scars, physical, psychological, and social, that can last a lifetime.
The online issue is part of the daily life of children in all countries. So we need, as you highlight, to make sure that when we are dealing with violence is all its forms, not one day child marriage, next day trafficking, and the third day after online. They are interlinked. And in addition to that, they are interlinked with violence against women and gender-based violence. So I want really to have a kind of wake-up call and to speak out of the box and to tell we can make it if we do it differently and bottom up and involving, children, community, religious leader. I heard a lot about raising awareness and so on, as active actors of positive change, not as passive recipients of services. And we can make it, and you can make it.
I'm very pleased to be here at this very important South Asia Ministerial Conference on Ending Violence Against Children. This platform comes at a critical moment as our region continues to confront both long-standing and emerging forms of violence that affects children's safety, dignity, and life chances. Sri Lanka considers the protection of children not only a sectoral concern, but a national priority embedded within our broader development, governance, and social justice framework. Over the years, we have made important progress in strengthening legal provisions, institutional mechanisms, and service delivery systems. Yet, we also recognize that violence against children remains a complex, adaptive challenge that cannot be addressed through isolated interventions alone. In this context, Sri Lanka has adopted a systems-based approach to ending violence against children, recognizing that child protection outcomes are shaped by the combined functioning of health, education, social security, justice, and community systems across the life course of the child. As was mentioned, building institutional capacity, especially human capacity, is one of the key challenges that we face and one of our key priorities. I think Sasindu also mentioned the fact that children don't have trust in systems. I don't think adults have trust in systems. And this is one of the most important things that we really need to address. At the foundational level, the public health sector continues to serve as one of the most critical entry points for child protection. Sri Lanka's long-standing investments in maternal and child health have ensured high immunization coverage, improved access to nutrition programs, and strengthened early childhood health interventions. These services are now complemented by expanded attention to maternal mental health, psychosocial support, and community-based outreach, particularly for vulnerable families. This integrated health platform plays a preventive role by addressing early risk factors that may later manifest as vulnerability to violence, neglect, or exploitation. Protection, however, cannot end within the health system alone. It must be sustained across the institutions that shape a child's development. The education system remains one of the most powerful environments for children. Schools are not only spaces for learning, but also critical sites for early identification of harm, psychosocial support, and safeguarding interventions. Sri Lanka continues to strengthen school-based child protection systems, including referral mechanisms, counseling services, and safeguarding protocols. There is also increasing emphasis on psychosocial well-being, bullying prevention, and mental health support within schools. In parallel, the education system is addressing emerging digital risks, including cyber safety, online exploitation, and harmful content, as children's learning and social environments are increasingly extended into digital spaces. In the most recent period, Sri Lanka strengthened its school-based safeguarding framework through reinforced policy directives, including a renewed emphasis on zero tolerance of corporal punishment and stronger accountability mechanisms. Safeguarding has also been broadened beyond physical protection to include emotional well-being, mental health, and protection from online harm. Beyond the school environment, child protection also depends on the broader socio-economic conditions in which children and families live, making social protection a critical pillar of safeguarding, and I cannot emphasize this enough. Sri Lanka's social security system plays an essential role in reducing structural vulnerabilities within households. Recent reforms under the Aswasuma program, our social protection scheme, have been strengthened. Targeted interventions and improved support to low-income families, the elderly, and persons with disabilities. We have certain universal social protections like health and education, but in addition, our health education policy is not just about ensuring that education is free, but that we also enable education with other interventions that we provide, such as free school textbooks for all children, shoes and stationery for low-income children, sanitary napkins for all girls over 12 years, and many such other initiatives that are aimed at ensuring that children remain in school and do not feel that they need to drop out of school for reasons where they cannot afford to be in school. These initiatives are supported by a gradual transition towards a more integrated, data-driven social protection system, including the development of social registries to improve transparency, reduce duplication, and strengthen efficiency in service delivery. Importantly, this architecture recognizes that economic stress and household security are key drivers of child vulnerability and therefore seeks to strengthen family resilience as a core prevention strategy. This is where our efforts to draw attention and also strengthen things like childcare systems, elderly care systems, disability services, all of these are in our approach essential if we are to ensure that this architecture that protects children are in place. In parallel, reforms continue to focus on improving efficiency, targeting, and coverage while making sure that our welfare systems are aligned with broader fiscal and structural reforms. Justice and law enforcement sectors have strengthened institutional response mechanisms. Specialized units within law enforcement agencies have been reinforced to deal with crimes against children and women, improving investigative capacity and responsiveness. Mechanisms such as the 1929 Child Helpline and child sensitive reporting systems continue to serve as important entry points for protection and referral, ensuring or attempting to ensure that reports of violence are received and acted upon in a timely and coordinated manner. However, we must acknowledge that despite all of these initiatives, there's much more we need to do, much room for improvement, particularly improvement in our coordination and collaboration between these different sectors that don't see themselves in isolation, but as a coordinated response that is about strengthening the system and the environment within which our children live. Sri Lanka has placed increasing emphasis on early childhood care and development as a foundational pillar of long-term violence prevention. The National Multi-Sectoral Strategic Action Plan, or in ECCD 2025-2029, reflects a shift towards greater integration of health, nutrition, early education, and child protection services under a unified framework. This initiative is led and coordinated by the Ministry of Women and Child Affairs, with implementation shared across key sectors, including the Ministry of Health, Ministry of Education, and provincial and local authorities. The National Secretariat for Early Childhood Development serves as the central coordinating mechanism. Efforts are also underway to strengthen curriculum standards and quality assurance in early learning centers, which have remained largely unregulated, reflecting a clear recognition that investment in early childhood is one of the most effective long-term strategies for reducing vulnerability and promoting protective environments. Despite these advances, significant challenges remain, including digital forms of violence, service delivery gaps, and inequalities in access to protection services. This, I think, is the problem that we've struggled with for over 10-15 years. Continued political commitment and institutional investment are essential to ensure that reforms translate into meaningful change at the community level, and that next year or the year after, when we again meet, that when children like Sasindu come up here and speak, they will be talking about the next level of problems and not these basic problems of service delivery gaps that we've been talking about for years. I would like to reiterate that legal and institutional reforms are not sufficient on their own. For years we have done this. We have brought in legal reforms. We have had endless campaigns to raise awareness, but we know that their effectiveness goes only so far. Ending violence against children requires addressing those deeper social and cultural norms, particularly around discipline and violence. Efforts to strengthen child rights-based approaches have at times encountered resistance where corporal punishment has been socially normalized. This underscores a critical lesson. Sustainable change requires enforcement of laws, sustained public education, community engagement, and long-term shifts in social norms. And those social norms can be shifted, but they cannot be shifted if we just look at it in isolation, but we look at what it is that sustains those social norms. That is what needs to be shifted. At the regional level, this conference provides an important opportunity to strengthen cooperation across South Asia. Challenges such as online exploitation, trafficking, and migration-related vulnerabilities are inherently transnational and require coordinated responses under the EVAC framework. Sri Lanka remains committed to deepening regional collaboration. I think the current world is telling us more and more that this is absolutely essential for our long-term security, strengthening data exchange, and enhancing collective capacity to protect children. I also want to say, I'm sure that many of us have been in similar conferences, similar meetings and workshops, and we have pretty much said the same thing for the last 10, 15 years. And I really think we need to understand why it has been, or try to now talk about why it is so difficult to shift or move these things along. And this is nothing to do with the problem itself, but our approach, our approaches and our interventions. I think we really need to now start thinking a little more differently, thinking more system-wide approaches. And I cannot reiterate this enough, the impact that poverty has on all of these things. And it's not just economic poverty, but how economic poverty can also lead to poverty in so many other ways as well, including our ability to shift norms, to shift political leadership, all of these issues. So in conclusion, I wish to return to a principle that must guide all our efforts. No violence against children is justifiable. All violence against children is preventable. United Nations World Report on Violence Against Children in 2006. Sri Lanka reaffirms its commitment to a comprehensive, system-based approach to ending violence against children. Our shared responsibility is clear: to ensure that every child grows in safety, learns in dignity, and develops to their full potential. Thank you very much, and I hope the rest of the deliberations go well. Thank you very much.
Thank you, Madam Prime Minister.